Let's bring in Dr. Howard Forman of the Yale School of Public Health for more. And Dr. Forman, you just heard that clip that we played right there. Dr. Fauci saying all of this was entirely preventable, but yet we are still in this situation with the amount of COVID cases tilting up. So I guess the natural question is, how high should we expect this wave of Delta to go, as we have a lot of parents specifically also concerned as schools start to reopen about possible increased spread once children are back in the classrooms?
Yeah, I think that we have a higher level of uncertainty now than we've had since the spring of last year, because there are so many moving parts. We don't know whether the vaccines are causing waning immunity, or rather whether waning immunity is occurring. We don't know whether it's primarily the Delta variant that's causing so many of the changes that we're seeing throughout the world and in the United States. We're getting very poor reporting from a lot of states, so it's very hard to know on the ground what's even going on. There are many states now that just report to us once a week in terms of their cases or their testing. Some states aren't even telling us how many tests are being performed. So we have a lot of uncertainty right now, but I do think we have a ways to go. And even when we get to that high, whatever high that is, we're probably going to be there for quite some time, because we don't have the same mitigation measures in place that we did a year ago, 9 months ago, and so on.
What does that say about how we should be looking at the trajectory of the pandemic? Is this just kind of something that we're going to have to live with through different waves and different variants?
I think at the moment what it says is that governors and mayors have a lot of responsibility to sort of manage their own locale as best they can, which may include masking, which may include other measures. And we have to hope that they take those measures at the right time to mitigate as much as possible. What's going to happen after this wave is unknown to anybody. We're really still very much in the dark. Too many people are acting as though the vaccines have waning immunity. We don't really have a lot of evidence on that yet. We have a modest amount of evidence, but in a lot of places, look to the UK, look to Israel, the protection against severe disease, the protection against deaths, the protection against hospitalizations remains very strong. Protection against infection appears across the board lower than we expected, but that may be more about Delta than it is about the vaccines. The combination of these things means that we just have much more uncertainty than we would like to have.
Dr. Forman, you bring up the degree of immunity from the vaccine. This is all happening during this kind of conversation about whether or not people should be looking to get a booster shot. We've heard some reports of possible recommendation for those that have more weak immune systems to get a booster shot. But you hear anecdotes of people wanting to talk to their doctors about right now getting a booster. What do you think is going to happen with regards to those types of recommendations? And could you see in the not so distant future people going out to get their second if you have a J&J, or the third shot if you've gotten Moderna or Pfizer?
Yeah, we know that people are already going out for shots and basically misleading or just not telling the centers that they've already been fully vaccinated. And I would just tell people to have a little bit of caution right now about doing that so easily. The immunocompromised population is one that we have really good data did not respond well to 2 shots in the case of the mRNA vaccines, or 1 shot with J&J. We had really good evidence of that. And we have really good evidence now that a 3rd shot does help them get a little bit closer to having vaccine immunity. So there are good reasons for that group. We also know that the most elderly also did not have great immunity after the 1st shot as compared with the youngest. So there may be a case to be made for getting a 3rd shot in that group, but we don't have the evidence for that yet. And it would be really good to just find that out before we start, allowing or telling people to go for the 3rd shot. Now, Israel is leading the way in this regard. They're vaccinating way down to, I think, anyone over 40 is getting a 3rd shot. They're going to give us a lot of information through that population, and maybe that will be the way to go. But I would just caution people that the vaccines are actually holding up very well against severe disease and death, not as well against incidental, asymptomatic, or mild infections.
On that front, we've got a global debate that's now playing out in terms of the necessity of the boosters. You've got the WHO saying essentially developing countries should halt the rollout of the booster because there just aren't enough vaccines for the rest of the world. Are the boosters really necessary to bring the virus under control in the U.S.? And how should we be looking at this push and pull between the developing countries and the developed countries?
Yeah, look, vaccine equity, health equity should be concerns for everybody on both the domestic and a global basis. We should be wanting to do the most good for the most people. And we're always going to be prioritizing our own country over other countries. But the question is, how much do you prioritize our country over other countries? And one should make the case that if we're going to use a third shot in this country, it should be for very good reasons and not because people are panicking or thinking something that might not be true. We do have an obligation to the world to look out for everybody as well. So while you may look out for your family first, you should also look out for other families.
Dr. Howard Forman, always good to have you on the show, Yale School of Public Health professor.